Securing a wheelchair for travel can be time-consuming. However, failing to secure the wheelchair is a dangerous practice. A wheelchair that is not tied down will slide around inside a moving vehicle. This is unsafe during normal driving conditions, but it is especially a problem in the event of a swerve, sharp turn, sudden stop, or crash. Only use wheelchairs that are advertised as transport safe or transport wheelchairs as seats in motor vehicles. If your child's wheelchair has the WC19 Compliant label on it, great. This label means that the manufacturer has designed the wheelchair for use as a seat in a motor vehicle. If you're not sure if your child's wheelchair has been approved for transport, contact the store where it was purchased or the manufacturer. If your wheelchair has not been approved for transport, the child should be transferred to a regular or adaptive car seat. Always secure a wheelchair to the floor of the car, bus, or van in which you are riding. The wheelchair needs to be anchored securely to the floor of the vehicle so that it does not become a large projectile, hurting the user or other passengers. Homemade solutions may appear sturdy, but most would probably fail under crash conditions. Never recommend, construct, or use homemade anchor systems. There should be at least 4 tie-down devices for the wheelchair, 2 in the front of the wheelchair and 2 in the rear. The securement straps may be a metal locking system or a webbing belt system. Center the wheelchair within the anchorages on the floor facing forward. The forward-facing position is the safest. The rider is more stable in this position, and passenger restraint systems are designed for this position. Set the brakes on both sides of the wheelchair. Turn off the wheelchair power if you are securing a power wheelchair. Remove any wheelchair-mounted equipment like trays, communication devices, and oxygen tanks. Equipment that is mounted to the wheelchair can come off in a crash situation, causing injury. Position the child in their wheelchair according to the IFSP, IEP, or therapist plan. In general, wheelchair riders with tilt and space wheelchairs should sit as upright as possible when traveling so that the torso belt fits snugly against their collar and breastbones to restrain forward movement of the upper body. However, keep in mind that each child's equipment and positioning is unique to them. It cannot be used for anyone else, and it needs to be used as prescribed. The therapist should be consulted if there are questions or concerns. Attach the straps to the wheelchair at 4 points. Only attach securement straps to the main frame of the wheelchair. The frame is the strongest part of the wheelchair. Don't let the straps bend around any object or become crisscrossed or twisted. Use the lap and shoulder belt provided in the vehicle. Securing the wheelchair is not enough. The wheelchair user must also be protected by shoulder and lap belts, which will keep them safely in their seat. Lap positioning belts and chest straps that are part of your wheelchair positioning system are not safety restraints, and they will not protect your child in a crash. Position the lap belt over the pelvic bones, not the abdomen. Position the lap belt inside the armrests between the side panels and the cushion. The seat belt protects the rider only if it fits snugly and low across the pelvis. The farther away from the body it is, the less protection it can give. Adjust the belt so it's snug. Position the shoulder belt so it does not cross the child's face or neck. Never position the shoulder belt under the student's arm where it would cross the rib cage. Adjust the shoulder belt to achieve firm but comfortable tension. Never twist the belts. The belt should lie flat against the body. Make sure that any positioning supports, the seat belts, or the securement straps are not pressing or rubbing any sensitive areas. Now you're ready to go. Here's a tip. It may be helpful to create a card that lists or illustrates how the chair and rider should be positioned and secured for transportation. For example, the card could indicate that the headrest should be in place, the plastic tray removed, and the wheelchair put in an upright position.